Hi guys, it's me Jimmy, and in this video I'll be taking you to a week of my life as an online medical student, currently in the pediatric rotation. So I have to get ready, I have to wear my scrubs for online meeting. Okay, so I'm already dressed and ready, so this is my usual setup for my online class with my iPad, and we have the calendar of activities. I'm actually in my 4th week already of my pediatric rotation, so we're scheduled for a well baby lecture for today, and yeah, excited to learn. So we just finished our lecture and we've been assigned to read a chapter in Nelson's about newborn care. Yes. And usually by this time I'm exercising after the lecture, but yesterday I just finished my workout program for 3 weeks, so I'm deciding to take a rest. So to everyone out there who's also, exercising and just finish a workout program, listen to your body and rest. Wait. Okay, so it's already the afternoon. A lot of things happened after the last time. After this morning's lecture, what did I do? I filmed another YouTube video. Then I had my lunch. I took a nap. I haven't studied yet. Sorry though. And now it's currently 4 p.m. and we just finished our 2 p.m. It was a Zoom meeting. We had a NICU audit. So NICU, a neonatal intensive care unit audit for the month of November and December for our school's hospital. So we medical students are not yet there. It's more for the residents and the consultants. They discuss the month's cases and what happened, some significant cases, and then we were just there to listen. The med students were there to listen. And we learned a lot of things, and I can say that we are still far from that level. Yeah, but tiny steps to everyone out there. So some of the cases included neonatal sepsis, hypoxia-induced encephalopathy, neonatal seizure, and we also learned about a neonate which was indicated for therapeutic hypothermia. It's effective within the first 6 hours of birth to decrease the cerebral metabolism and maintain the body temperature at 33.5 to 34.5 degrees Celsius. A lot of learnings, a lot of important highlights which the consultants wanted to emphasize, especially within the first 60 seconds of a neonate's life. You have to ensure that they can live. Hopefully, I can remember these things when it's time for face-to-face. So that's for today, for Monday. So, also, our doctor also posted our case for this week. So it's about neonatal jaundice. So I have to read up on that too. I have to make primary impressions and differential diagnosis for the patient, and also some diagnostics and treatment. I'm still not used to vlogging, so you'll just see my face. See you tomorrow. Come on. Hi guys, good morning. It's another day. It's a Tuesday, and I didn't video it, but I just came off from another audit, hospital audit. So I didn't video it because we're not allowed to video any hospital things, and also it's just us medical students again watching the residents and the consultants discuss the topics for the November and December hospital cases. So notable ones included dilated cardiomyopathy, a CNS bleed, neonatal pneumonia, and also the consultants shared their knowledge, which was very informative. So that's my day so far. I didn't vlog it last night, but I already began making my concept map. So after yesterday, our resident doctor gave us a case, and most likely it's about jaundice, specifically breast milk jaundice based on my readings. So we are tasked to make a concept map, we have to convene in our subgroups to make a case discussion which we'll present tomorrow. I'll show it to you later, the initial draft of the concept map I've made, and then I'll finish it today. And the other activity for today will still be later at 1 p.m. We have a journal club. I've already done my journal club in the second week. The subgroup picks a journal and they critically appraise it, and they should be able to choose a journal which has a significant impact, maybe new findings. The journal we chose at that time was using lower dose zinc supplementation as an adjunct to treatment in diarrhea for patients. Instead of using the standard 20 milligram dose, the journal wanted to see if it was superior in terms of the side effects of vomiting, but not inferior with the treatment efficacy. They used lower dose of 5 and 10 milligram doses. So later, we'll see what the journal club this week chose. Please see you later, alligator. Also, other exciting news is yesterday, I received a text for my chosen PGI hospital about the scheduled interview, which will be this Friday. We'll see. I'm hoping for the best and to be accepted.
And assess outcomes in those with add-on treatment such as nebulization and pump inhibitors, and to stratify patients into those who are third or repeated.
And finally, emergency exits of the mask, all in order to achieve an artificial airway. Simulation was done prior to the planned procedure.
So what you guys saw was an inter-hospital case conference. Two pediatric residents from another hospital presented some interesting cases. The first case presented was about penile agenesis. The child had a karyotype of 46XY, but patient presented with the penile agenesis, so that was interesting. The next case was about an exit procedure. So an exit procedure means an ex utero intrapartum treatment procedure. So this was done because on prenatal ultrasound, the fetus had a mass near the neck. So it was done to prevent any airway obstruction so that the child can live. Thankfully, the procedure was successful. I think the child was at 30 weeks AOG. So yeah. So immediately after that inter-hospital case conference, our subgroup has to report again for our case. Our case was about breast milk jaundice, and today I'm assigned to report a part of it, specifically the primary impression and the pathophysiology. So basing on the patient's clinical manifestation and also the given laboratory results, our primary impression would be breast milk jaundice. So this is considered since breast milk jaundice causes an elevation of unconjugated bilirubin, which occurs after the 7th day of life in 2% of breastfed term infants. So we just got off from our case presentation with our resident doctor. Today we just reported initially, but tomorrow will be the final, and it will be with our consultant doctor. Right now we just discussed up to the differential diagnosis, but tomorrow we will include the diagnostics, of course in the words of the patient, and also the management. Also, yesterday I told you that I was going to show you my initial concept map. However, I failed to do so, so I'm just going to show you my final product for my initial concept map because we have to do 2 concept maps. So today we have to pass the initial concept map, and tomorrow we will pass our final concept map where we include our diagnostics and management. So these are the concept maps of the group. This is mine. That's it. Please don't judge me. I'm not that good at making concept map. 28-day-old female neonate, and primary impression, breast milk jaundice, pathophysiology, and all that. And I'm leaving a space here, and also I'm probably going to adjust here so that I'm going to include my diagnostics and management, and also the course and the words for the patient. So that's it.
Breast milk jaundice is elevation of unconjugated bilirubin that occurs after infants. It may persist for 3 to 10 weeks at lower levels when breastfeeding is continued.
So we just finished our last case presentation for General Pediatrics, and now I've decided to continue with my workout program because I feel like my body is ready. Let's go. finished my workout. Hirap maging fat. Everyone, take care of your health. So we just finished the morbidity and mortality case conference. It's similar to the previous 2 days. It's like an audit, and I like that the residents and consultants talk about the cases and also about us fourth-year medical students who are about to go to face-to-face duty, and the safety of the school, the safety of the hospital, if it's safe for us. I don't know if it's safe for us. Okay, so time check. So it's almost 10:30, and what I didn't vlog today is that on 9 a.m. we had a quiz for our last week here in the General Pediatrics rotation. The quiz covered the cases we had, so it was just a 10-item, actually a 9-item quiz. And I didn't vlog it because obviously I was taking a quiz. It required 2 devices. So one, we required a laptop so that we answer the quiz from, and then another device so that we had a Zoom meeting on that device so that the doctors can see us taking the quiz. So it prevents us from cheating and all that things. Guys, don't cheat, okay? Honor before excellence. For the quiz, I think I did okay. So we're going to have a meeting with the group. We're going to make a rationalization video on the items, what we think are the correct items. Yeah. Learnings! It's almost 10:30 and we're going to have a general assembly about possible face-to-face in the next coming weeks. And it's making me nervous.
Who are still stranded in their area.
Saturday, last day, so we have the PGI doing the critical appraisal. The appraisal just ended. The one doing the appraisal this time was our PGI, or a postgraduate intern, so they're a year ahead of us. It was the last event of our General Pediatrics rotation. That's it. Yeah, so this rotation was a very good rotation. We got to learn a lot of things about pediatrics. We were able to revisit some old concepts and also understand newer and more complicated concepts. And I hope that I bring these lessons with me when it comes to face-to-face. I also want to learn more about the skills to actually do some procedures and care for the patient. The pediatric population is a very unique population, a separate population. It's something that you don't get to understand quickly on your first go. The pediatric population is a lot of getting used to. Different vital signs with different ages, developmental milestones, different with each stage of life, the different phases of their development, domains, different disease entities, different disease etiologies affecting each child at different ages. And it's something that can be daunting to a lot of medical students when it comes to the pediatric rotation. So today is Saturday, tomorrow pohon is Sunday, but it's a free day for us. We don't have any activities. So what we do is just we fill out our online portfolio where we put in all the files and all the things that we did for the week. So technically today is the last day of my General Pediatrics rotation. Thank you, General Pedia rotation. Excited to be back again here, hopefully in actual face-to-face. Next will be in the pediatric subspecialty rotation. So that's my week in the life of an online medical student. Comment yours. Are you an online medical student too? Comment it down below. If you like this video, make sure to like, share, and subscribe. Share it with your friends. That's it. I'm Jimmy, and see you on the next one. Bye!